fighting this disease had to be a national security priority.
In the middle of this village, we have Ebola victims, and there are two or three here, these women and their baby daughter, and another man just down the road, and they're all believed to have the virus. They're just being left here.
The overall goal of the Modern Plagues Conference is to bring together many people from many different perspectives, different fields, different occupations, to have an important conversation about global health. We chose the topic of Ebola not to necessarily just focus on Ebola, but because it provides a lens through which we can discuss many of the critical issues facing many aspects of global health today.
There have been a lot of conferences on the Ebola crisis and on some of the public health issues related to it. This particular conference is different in that it takes an interdisciplinary view of the issues and brings to bear a broad range of disciplines: history, economics, policy science, political science, molecular biology, draws them together and draws not only on academics but also on policymakers from NGOs and from government.
I think one of the lessons that previous healthcare, global health crises can teach us is the omnipresence of overreaction, driven by fear, misunderstanding, confusion, and the imperfections of our political processes.
We were caught unprepared. Unprepared to detect a disease happening in a new area with strong features. We had no drugs, we had no vaccines, we had really very little public health measures.
Anything you might do is going to cost money, and that money has to come from somewhere. I think the simplest view that when people are in trouble, if you throw money at it, that'll fix it. We know that that's not really right.
We like to think about the crisis being over when people stop falling ill, but as we're discovering, survivors have a range of problems that are going to be with them for a long time. From what we know from a variety of other circumstances, children who are impacted by this type of disaster will bear long-term effects, and that should be kept in mind when thinking about how to aid them down the road.
The takeaway from this conference will be the macro perspective on how epidemic diseases are conquered and how effective policies are designed. But you'll get a perspective from a historical perspective, a political perspective. You'll get a sense of the science and the healthcare behind this, or the health research behind this. You'll get a sense of the cost underlying these responses. So the nice thing about this conference is that in one place you'll have all these conversations, all this engagement and intellectual engagement that will be useful for scholars and policymakers in terms of how they think about the spread of epidemic diseases. And to have that worldview of all these moving parts in one place is why this conference is so valuable.